Yeah. So we're in the feed room, and this is Courtney, who is a graduate of SUNY Cobleskill. Very nice rider. Courtney was on the riding team, and horses like Courtney. That's one thing I always noticed about her. She always did a nice job because horses like her. So she's working in the perfect place. So, and you notice every horse has individual buckets. I imagine a lot of supplementation just because of the age of the horses and their
Yes.
issues.
Yes.
That's got to be a little time consuming.
Yeah, it takes about 30-40 minutes to do grain every day.
yeah.
So.
And a little bit of variety of grain, probably a base grain, and then
Yeah,
adapt it to the individual.
we have the base senior and then the balancer, and then we have a little bit of variety after that. Some sentinel and then field for nutrient. So.
Oh, okay.
Yeah.
Well, great. Well, thank you very much.
Thank you.
And I'm going to keep the video going as we walk in.
So this is our main barn, and pretty much it's for horses recovering from injuries, illnesses, and horses that have special needs. Today we started to introduce these two Mustangs, Hayden and Kachina. Kachina came here in May, and Hayden has been here since 2013. The reason he's up at the barn is because he cannot no longer have grass. He has metabolic disease, and this is actually Kachina, and they're traded stalls. This is Hayden. The introduction, I have to say, is it's been pretty quiet and very successful so far. As you can see, I mean, they've been introduced now for quite a while. Since May 10th, they've been next door to each other. So today is the first day they're together, and as you can see, there's very little action
Right,
going
yeah.
on, which is a good thing.
Yeah, very happy.
This is Monty over here. This was.
Oh, yeah, this is. Yeah.
This is a thoroughbred Honor Mountain, who actually, I believe, raced at Finger Lakes and then came to SUNY Cobleskill. He has what we think may be equine enteritis. We're not quite sure. The vet has been here a couple of times, and so he's getting fluids right now. And she's taken all kinds of blood tests and tests to see if possibly he might have a tick-borne disease. We don't have an exact diagnosis yet, but he's on antibiotics, and we're doing everything we can to try to figure this out. To do what we can until it is figured out, and we do have a diagnosis.
This is, as you look now again, the whole farm is designed for horses as opposed to being designed for clients. So you will notice some differences in barn structure, and of course the horses are only in the barn if they need to be in the barn. They're living out normally with shelter and water and food. But you'll notice a relaxation as well, and communication possible, less grills, space between the stalls. Very different than a typical performance horse barn.
This is Dolly. Dolly, would you like to turn around, honey? Dolly's not feeling so good. Dolly was an Amish workhorse that we rescued in 2001. And in all those years, she had one gas colic. She was never sick a day in her life. All of a sudden, a couple months ago, she started to go lame. And we're not really sure what it is. Our farrier, who's also an equine podiatrist, thinks it may be a soft tissue injury inside the hoof capsule that you can't see with ultrasound and x-rays. So we're hoping, he's giving her some special shoes. He's going to be back on Friday. In the meantime, he wants her on stall rest. But if she doesn't get better, then we may have to go to an MRI, because we won't really know exactly what it is. But that's, the last resort if she doesn't start to get better. This is one of my favorite horses in the whole world. So, the idea that, and she's just a wonderful horse. When we have young kids here, she's great with them. You can have 30 kids hanging off of her, and she just will stand there like she goes to sleep. It's just a sweet, you know, she's a really valuable, for us, a sentimentally valuable horse, as they all are, but she's a, you know, she has a fan base, let's put it that way.
yeah.
So, you know, she's not at her best right now because she doesn't feel well.
Right.
But, you know, we're hoping that she recovers. Over here, these two are in their opposite stalls. This is our most famous horse. This is Bobby Two Freedom. He was a former New York City carriage horse who we rescued out of a kill pen at New Holland in 2010. Bobby also has all kinds of changes in his feet due to the kind of shoes he had to wear on the streets of New York. And, you know, so when he first came, he had torn flexor tendons, so he had to wear a backward egg bar shoe to take the pressure off the tendons. Now he has changes, navicular changes. All of these issues we saw in an MRI when he first, we had him sent to Cornell, so we knew exactly what was wrong with him. The vet that looked at his pictures said it was the worst MRI he ever saw. So it takes a certain amount of maintenance to make sure, as the changes take place over time, as he ages, the pain is going to, the discomfort, I should say, is going to manifest itself in different ways. So we have two really great farriers. One is an equine podiatrist and a veterinarian, and the other is an incredible farrier. And so between the two of them, you know, we're able to figure out what type of shoes are best so that the horse can maintain the comfort levels. You know, we're most interested in the quality of life. We're not just interested in keeping horses around for the sake of keeping them around. So as long as they have a quality of life and they respond, then we give that horse a chance. And this is Bobby's best friend. This is Dallas. We rescued Dallas in 1997 when he was 8 years old, so that means he turned 31 this year. And Dallas recently had to go to the hospital because he had pneumonia and sinusitis. So he was, looks pretty good for his age.
Yeah, I'll say.
And he and Bobby are really great friends. So, again, given his age, you know, he seems to be doing really well. He's on a very, very strong antibiotic called chloramphenicol, which has to be administered with gloves and a mask. It's probably one of the strongest antibiotics you can give because he was having coughing fits and, you know, but we have a diagnosis, so he's on the mend and doing well. This is Flame, and she's also recovering. If you look at her feet and legs, she developed a wing fracture following an abscess, and so she's being treated by the equine podiatrist. She's a thoroughbred who I rescued at the kill pens in Sugar Creek, Ohio. She had come right off the racetrack at Mountaineer Park, and she was 5 years old then, so she's an older lady right now, but she's awfully sweet, and you know, we're giving her a chance. Hopefully she'll recover. We know she's in the best hands in terms of what to do for this problem, so you know, we're hoping that she recovers quickly. This is Rigo. He is a former show horse.
Hey, Rigo.
He was a high jumper. I don't really know the level. I think he was pretty high up in his competition status, but he has, after having him,
You can't eat it.
he doesn't walk, he walks sort of like a drunken sailor. So we had him x-rayed, and he has a problem with his neck. And so we think he's going to get, Melissa, what is the treatment again? Can I introduce Melissa Murray?
Sure.
She's our equine care manager.
Hey there. Thank you.
Drawing up some antibiotics for someone else. Regal was a children's equitation horse and a show jumper. And I think he competed up to 4 foot.
Uh-huh.
And he has arthritis in his spine that's causing spinal ataxia. So that's giving him kind of a neurological type component to his walk.
Right.
So we tried your standard steroid injection in the joint. And then what we're going to be doing, since that didn't last as long as it could have, we're going to be doing PRP treatment, which is plasma-rich platelet treatment. That's where they'll draw his blood, they'll spin it down, they'll take out the plasma from it and inject it into his neck. I believe it's the plasma that they inject in there.
Yeah.
And then we're going to combine that along with a long-term systemic steroid that can be given on farm to help manage his ataxia that
Uh-huh.
he's experiencing. So.
Good. Thank you very much.
You're welcome.
Okay, here's the clean part of the barn, okay?
Yeah.
This is Janie. Janie is a 12-year-old thoroughbred mare who was rescued out of a kill pen last summer. She is related to Secretariat. I think she's a great granddaughter, or
Uh-huh.
at least her lineage goes back to Secretariat. I
Right.
don't want to give this information. But she was rescued, pardon me, by Gerda, of Gerda's Horse Rescue up in Vermont. And she needed to go to a sanctuary. So the horse next door needed a companion, and because she is a horse that's extremely unsound. She's unraced as a thoroughbred, but registered. We have no idea who had her, what happened to her, but she has some really bad arthritis in her front feet.
Uh-huh.
And so our podiatrist is also trying to change the angle of her feet so that she could be more comfortable. So she doesn't actually need to be outside running around yet.
Right.
Hopefully she will be. I mean, the tragedy to me about this horse is how young she is. She's a beautiful thoroughbred, but she's totally unrideable. So
Right.
hopefully we'll be able to get her pasture sound, which I think she actually is now, but even more comfortable, so that we can manage the problems that she has with corrective shoeing as
Mhm.
opposed to any medical procedure.
Right. Yeah.
This guy, this is Zach. Big Zach
Hey,
weighs
Zach.
2,000 pounds. He was weighed at Cornell. This horse breaks everyone's heart. We know very little about him other than the fact that he was seized by police during a cruelty raid a few years ago. He ended up at an SPCA in Western New York, I don't know which one. And he was not examined or evaluated, but rather he was placed in 2 different homes. I was told both homes wanted to use him for things, which he has no ability to do. He's very unsound. He has all kinds of problems. And so when the people that got him found that they couldn't use him, they kept returning him to the SPCA, which did not have the ability to care for
Right.
him. So one of the investigators on the case who was involved in seizing him called me up and said, would you please take this horse? So we brought him here. He's a perfect horse for sanctuary because he really, and he's in his 20s. You know, Melissa, who you just spoke with, says she believes that somebody once loved this horse because when she grooms him, which involves standing on a ladder,
Yeah.
he stands perfectly. He's a sweet horse. Who knows what happened? Maybe he was sold to somebody and then ended up really in squalor. He was totally emaciated. I've seen the photographs the day he was seized. He's beaten cancer on the 3rd eyelid of his right eye, but now he's developed canker in all 4 feet. And now the podiatrist who works on him thinks he may have a muscular disease, something possibly like shivers or EPSM or something muscular. So we don't really know what that is yet. We're going to have to see if he can be checked out to see if we can determine what it is. I don't think you can actually diagnose shivers unless it's during a necropsy, so we're not ready for that. We're not ready for that. But this horse is a favorite here, and you know, I think had he not been neglected for so many years, we wouldn't have these problems right now.
Right.
But he does, and he seems to have a compromised immune system because of these things that he keeps developing. But for as long as, you know, he wants to keep going, and for as long as we are able to care for him, we will do so. And you know, when it's time, if we reach a point where we can't help him, then we will have to put him down. But we're trying to do everything in the meantime to keep him going.
Great.